Okay, consequences will come with this decision too. Also,
Every kind of consequences will come in with the price.
welcome to Dentares Smile Clinic's informative video series. Today we are diving into one of the most popular treatments in Turkey, dental veneers. If you are considering getting dental veneers in Turkey, you are in the right place. Dr. Öyküm, it is great to have you with us again. Let's start with the basic.
Hi everybody.
What exactly are dental veneers?
Dental veneers is a type of treatment that we use for improving people's smile, chipped tooth, staining issues. And there are some types of dental veneers actually. And commonly people are misunderstanding the types of dental veneers. That's why we're having this video right now.
Indeed. Okay, as you mentioned before, many people are curious about the differences between laminate veneers and full veneers. So, could you please explain this for us?
There are two types of actual dental veneers. First type is laminate veneers. In laminate veneers, the preparation is lesser than a full dental veneers. So we are shaving only the frontal surface of the tooth structure. So it is less invasive treatment compared to full dental crowns. In full dental crowns, you have to shave every space, every surface of the tooth structure. But of course, there are some disadvantages and advantages of the laminate veneers and dental veneers. So the real consultation, really important. Up to people's case, the decision has to be made by the professional doctor.
Okay, thank you. One of the most common questions we get is about the procedure, as you know. What's the procedure for getting dental veneers in Turkey?
Actually, first of all, as I mentioned before, the decision has to be done by patient and the professional doctor together. For this, first of all, you have to visit the doctor. Then you'll have a real consultation, not from the pictures, on call. You have to have an x-ray. You have to diagnose well about how healthy your tooth structure, your gum structure, and up to your condition of your mouth. Then professional doctor will offer you having laminate crowns or full dental veneer crown. Okay?
Okay, thank you. Who are good candidates for veneers?
For any kind of medical treatment, first of all, you need to be healthy. So when you visit the doctor or dental clinic, the tooth structure has to be healthy enough to hold the crown or laminate. Also, the gum structure has to be healthy for any kind of dental procedure. So the first step is visiting a doctor, then having a perfect dental consultation. Then if any kind of issues about gum structure, soft tissue, cavities at the tooth structure, these diseases, these problems has to be treated. Then you are ready to go for the prosthetic move.
Okay. Also, could you please let us know, for example, if you have crowded teeth, is it possible to get laminate veneers?
Actually, this is a common issue. People have some issues about rotated ones, very crowded or squeezed mouth. They thought that laminate is an option for them. But actually, if the orthodontic problem is huge, then you have to gain space by shaving the tooth structure. So actually, for having laminate veneers, you have to be healthy enough and you need space. Unfortunately, not is 100% of the people have chance to get laminate veneers. Only small amount of people have chance to get laminate veneers. People are thinking about the lesser invasive procedures will be better compared to having a full mouth crowns, but it's not that easy. We are not magicians. We don't have magic sticks. So even it's a lesser invasive treatment, we need space to make a better aesthetic, to improve your smile. Also, we have to give you a functional biting line, a chewing power. So all these structures has to be in a row. So even one of them is not in the right space, you are not a good candidate for laminate veneers. Then you have to move on with full dental crowns.
Okay. First up, are veneers permanent? How long do they last?
Actually, people are waiting too long to have full mouth treatments, both for laminate crowns or for full dental veneer crowns, but they have to know that none of the treatment in the world, not now, we are not able to give this lifetime guarantee or lifetime expectancy. So of course there is a lifetime of these materials. If the oral hygiene is perfect, if the patient is so careful about keeping them safe, 10 to 15 years up to general medical and oral hygiene, they can have their treatment in their mouth without renewing them. But if the patient is not taking care of their oral hygiene, if for example a few years later they have general health disease like diabetes, and which it could cause huge bone resorption, of course there has to be renewed. This lifetime expectancy could decrease after the patient's care and the general health issues. But in a perfect mouth, in a perfect oral hygiene, 10 to 15 years is okay. Then we are not getting younger every year. So like our face, our body, our mouth structure is getting older. After 10 to 15 years, gums will shrinkage, bone will resorb. So you have to have a new set of crowns or laminates again. Arrangements are needed, adjustments are needed. So up to your new shape, bone structure and your soft tissue, you need new treatment. This is the reality. We have to be 100% honest to your patients. If somebody tells you you will have them for lifetime, run.
Indeed. Okay, how about caring for veneers? You mentioned oral hygiene. So at this point, will they teeth sensitive, or how to take care of them well?
First of all, after the shaving process, all the structure will be a little bit sensitive. This is very normal. And after the finishing of treatment, because we are using some chemicals for cementation, up to people, because every patient is individual. In some cases, this hypersensitivity could last only 3 days, sometimes 3 weeks. So after the finishing of treatment, this hypersensitivity will occur. This is reality, because our body, our mouth structure giving reactions to these chemicals, which is very normal. But this is a process and this will end. But you have to be patient about it. You're having a big treatment. You have to know this. You have to accept the consequences of this treatment. Then, yes, it will be like your own tooth structure. But first of all, you have to know and accept that your tooth is still there. Even you have a laminate or a crown, the inner structure of the tooth is your own tooth structure. So if you don't brush well, if you don't take care well, if you don't careful about what you eat, of course, like your own tooth structure, you will have problems if you don't take care of them. Don't forget.
Can the patient eat anything with veneers, or do they stain over time?
You may eat whatever you want. A normal feeding process is still could be done by these crowns, these dental veneers. But of course, bad habits cause issues like chewing gum all the time. God designed this tooth structure to eat, not heat them for hours and hours. So chewing gum is a problem. Any kind of sticky food, if you eat too much, could cause the cementation of these crowns. If you smoke too much, then you may have some staining issues. If you drink coffee too much, you have some staining problems. So you can't open your bottle just like your own tooth structure with your crowns. You can cut the ropes with your crowns or laminates. You are not supposed to chew chewing gums for hours. So you have to take care of them not only by brushing, but also taking care of what you eat as well. These fabricated structures. This is done by machines and by human hand. So you have to be careful about them. Okay?
Okay, thank you. Finally, the big question. How much do veneers cost in Turkey for a full mouth work?
Actually, this is a very interesting question, because what kind of material lab is using, what kind of quality you are preferring is making the difference of the prices. If you go any kind of cheap materials, cheap clinics, you may find some very affordable and very cheap prices for you. But you have to be so careful about, just like your oral hygiene, what material is used in your mouth, what kind of clinic, what they have experience about this kind of patients before. You have to check every detail well. Then up to your budget, of course, you you may find cheaper crowns, moderate crowns, expensive crowns. Price is actually decided by the clinics and doctors in Turkey. Unfortunately, there is not a subsequent price level for every clinic. There are differences between the clinics. But of course, if you want to have a better treatment, better material, experienced doctor, you have to pay more compared to this advertisements all over the Europe, because you may find very cheap prices in Turkey as well. You have to this is your life, this is your body, this is your health, so you will make this decision. What kind of price I can afford? What clinic should I go to? So this is your questions, you will find the answer, not us.
Okay, consequences will come with this decision too. Also,
every kind of consequences will come in with the price.
indeed. Okay, so what about UK compared to Turkey? The prices, about veneers, of course. What are the differences between UK and the Turkey?
Right now, most of the clinics' prices are cheaper than UK. Not only for the price, in my opinion, because of the NHS system problems. They can't find appointment doctor enough to make their treatments in their country. That's why people are searching for dental clinics in all over the Europe. So if you have a very big treatment, if you need implants, full mouth of crowns, of course, the total price will be better compared to UK in Turkey. So if I were an English patient actually, and if I need a very big dental treatments, I would prefer to go to Turkey for having them.
Thank you, Dr. Öyküm, for sharing your expertise with us. For those interested in learning more about veneers in Turkey, feel free to reach out to us at Dentares Smile Clinic. Don't forget to like, comment, and subscribe for more informative videos.